I want you to welcome on stage Dr. Kevin Ronneberg, who's the Associate Medical Director of Target Clinics and Pharmacy Professional Services. He's a board-certified family practice physician responsible for providing insight into Target clinic and pharmacy services. He guides business continuity at Target. Also, Amy Tenderich is with us, journalist, blogger, founder of DiabetesMine.com. She's the co-author of Know Your Numbers, Outlive Your Diabetes, a motivational guide to dealing with diabetes. And Tim Brown, the legendary Tim Brown, a leading voice on the value of design thinking. He participates in the World Economic Forum at Davos and is president and CEO of IDEO. First of all, welcome to the three of you. Thanks for coming. And we'll let you begin, Doctor.
Okay. Thank you, John, for that wonderful introduction. As John said, I'm Kevin Ronneberg, Associate Medical Director for Target. And I'm excited to be here, and I'm very excited to hear Tim and Amy's thoughts as we think about bringing design principles and consumer perspectives into the healthcare discussion and how we can simplify healthcare. I have a unique role in that I'm a practicing physician on one hand, and on the other hand, I'm in charge for guest-facing healthcare services at a large retailer, including Target's pharmacies and clinics business. I also have an opportunity within that role to see how strategies that have been applied to engage retail guests can also be applied to engage our guests along their health and well-being. So having said that, John mentioned that we have polling devices out there. I'm going to start out with a question. The first question is, would you rate navigating the healthcare system today as simple? 1 for yes, 2 for no.
Did you get the rights for that tune?
Talk to my people.
All right, I will.
All right, so let's look at the answers. Oh. So do we have the answers to pop up?
There we go.
There we go. All right. So not surprisingly, we have a room here of pretty sophisticated healthcare individuals that should understand navigating the healthcare system pretty well. And even in this audience, 95% say no. When we think about retail, this is exactly the opposite of what our consumers at Target are looking for. Our guests at Target, you'll hear me use the term guests throughout the presentation because at Target we refer to our customers as guests. So let's ask another question. Do you feel confident that you have the information you need to choose the right healthcare provider from all the choices that are available to you? Again, 1 for yes, 2 for no. All right, let's see if we can get the answers up. So here again, we have a little bit of a split audience. Again, there's a lot of people in this room that understand the healthcare system better than probably the average population, so not a surprise that there's some that say yes, but 65% of the people in this room say no, that they don't feel that they have the right information. And I think about when I receive my network of physicians, and I don't know how many thousands are in there, how do I make choice? We oftentimes think of choice as something where it's about volume. The more choices, the better. The more information, the better. What we find in retail, that it's just the opposite. We find that oftentimes if we provide too much choice to individuals, that they actually find it overwhelming, and sometimes we'll step back and disengage, and oftentimes not even make a decision or a choice. So in retail, what we do is we curate a selection of products for the guests to choose what's best for them. And by doing that, we create a manageable assortment so a person can feel that they've made the best choice to meet their needs. They feel very confident in that choice, and they're very likely to continue to engage. Now, we're at Mayo, so it's only right that I introduce that there's some research behind this too. Consumer behavior expert Philip Graves did some research on retail. And what he found is on a display similar to what you see in front of you, that 7 times more merchandise was purchased in a display that featured 6 products compared to a display that featured 24 products. What he also noticed is that once you went beyond 10 items to select from, people's satisfaction with their selection dropped significantly. What we find in retail and at Target is that if we offer a variety of choices across a spectrum, which oftentimes we call good, better, best when we talk about products, that people are more likely to feel confident in their choices and feel that their needs are being met, but it allows them to have that choice to maybe make a decision around quality or a decision around cost, but whatever it is that they're looking for, they feel that their needs can be met in that situation. One example that you see in front of you is Simply Balanced. So a very clearly labeled product where there's a variety of food lines in the store that eliminates artificial colors, flavors, preservatives, so that now an individual that's searching for that particular need can identify that throughout the store. So it's also about how is it we create clarity of messaging for people to find what they're looking for. So as we think about that, how do we introduce that design into the choice through the environment, through the products, and through the services, so that a guest can step into choice, or a patient can step into choice and feel confident in that choice? I just want to point out that choices aren't always something that we allow our guests to make. We're an employer of 360,000 team members nationwide, or across the world. And we understand the impact of tobacco not only on our team members, but the community. And as we seek to create healthy communities, we've chosen to eliminate tobacco products from our stores. And our guests have been very supportive of that. I want to shift in retail the focus that we need to have on our guests. If we don't understand what it is that our guests are needing, what it is they're wanting, the problems that they're attempting to solve for, we don't know what solutions to put in front of them, and we're not going to be successful in that endeavor. We can't take an approach that one size fits all, because every guest has different needs, and you can probably just look around your tables and decide that each of you are going to have different shopping patterns and needs when you enter a retail environment. So we really need to focus again on how is it we apply that design to the products, services, and environment. When we get the right products in store, then it comes to how do we engage that guest that's in our store. And people will respond differently, whether it's signage, product placement. If we put two items together, like a blood pressure cuff and low-dose aspirin, we refer to that as adjacency, and we see that people step into engaging around those products differently. I've enjoyed hearing a lot of the conversation over the last couple days and even this morning about the need to extend the healthcare experience beyond the existing hospitals and clinics, and looking for where it is that we can insert that into people's daily lives and routines. We've built the healthcare experience traditionally over the last several decades around people like myself as a physician, around my schedule, my needs. How do we make it convenient for me as the rate-limiting step in a clinic day or hospital rounding? There's no way retail can survive taking that approach. We need to put the guest, the patient, at the center of our conversation. And having said that, I think that's why we're going to see a more rapid adoption of alternative sites of care. We're going to do a little ad-lib polling. This requires you to raise your arm, so this is some fitness here too. But let's go to last influenza season. How many people in this room received a flu shot in a pharmacy or a retail clinic location? So we see several arms going up. Now, if we think back 5 or 6 years ago, how many of you had a immunization in the same location like that? Just a couple.
Well, let's get the baseline. How many got flu shots generally? Yeah. And you would assume most of them would be in doctors' offices?
Correct.
Right, okay.
Yeah. So
right.
as we look at introducing pharmacists into play, pharmacists are located where we know our guests are in our stores once a month. If they're a pharmacy guest, they're in our stores twice a month. So we create an opportunity to get flu shots in a Target store. And then we asked people that received flu shots in 2011, did you plan on getting a flu shot when you came into the store today? 54% said no, I had no intention of getting immunized. But we were able to engage them around something that's good for their health through in-store signage, perhaps a person having a conversation with them. And they made what we call in retail an impulse buy. And I'm sure everybody in here understands what impulse buys are in retail. So we've taken that concept of an impulse buy and transitioned that into healthcare. So another question, do you have a design team, designated design experts, or similar titles on staff in your organization? 1 for yes, 2 for no. All right, let's see the answers. So that's great to see, and again, I would say that because we're at Mayo, and we know Mayo has a Center for Innovation, and there's others here that are really interested in design, that we see 61% have that in their organization. And we have 40% that say they don't. I think it's really imperative to think about how it is that you introduce that, either through building your own or partnering with others that are doing this work. Let's see if I can advance. There we go. Design is vital to retail. Target has a long history of innovation by design, and we have our own design experts internally, and we've also partnered externally. We've seen that design show up in the store environment, both externally and internally in the store, the ergonomically designed shopping carts, and then also partnerships that some of you may be aware of with design, famous designers around exclusive products offerings. And I think it's important to point out that that design around the experience and the products is just as important as the products and services themselves. We can't have one without the other and be successful. So another example in healthcare where we've taken that concept of design and applied it to healthcare is we were approached by a design student several years ago named Deborah Adler. And she had an idea about changing the prescription bottle that for many, many years we had all accepted as needing to be yellowish brown, round, and having a white cap on it that's difficult to open. And because of some problems that her parents had run into with mixing up medications, she came up with a design that you see on the screen that won't roll away from you if it lays on its side. It has a cap that's easier to grip and open. It has color-coded rings to separate prescriptions between yourself and your spouse or family members so that we don't mix them up. And most importantly, as we think about putting the guest or the patient at the center, is you see the most important information in the largest font at the top, which is who's the guest, what's the medication, what are the instructions. The least important information should be at the bottom, which is where did you get that medication from. And this is just one example of where we've seen the ability to take design and improve the guest experience and hopefully create some simplification in this complex healthcare experience that we all are aware of. So having said that, I'm going to turn it back to John, and I look forward to hearing additional comments from both Tim and Amy from their respective points of view on how it is that we can simplify healthcare.
Thank you. We appreciate the ideas, but also we appreciate the potential vulnerability you're signing yourself up for, because we're going to take this idea to some extremes. That's why we've asked Tim and Amy to be here, to really sort of poll the audience as well on what are the limitations of the retail experience as an intervention in healthcare. Since you mentioned guests over and over again, just to try to get into the mind of Target corporate culture, you don't refer to the money that they leave behind at the store as tips, do you?
Not that I've heard.
Okay, great. I just wanted to know if there's any sort of consistency there. First of all, Tim, Amy, questions that come immediately to mind about the opportunity to intervene in the healthcare experience in a place like Target and some of the ideas that they've presented.
Do you want to go first? Well, so I mentioned this yesterday when we were in the middle of the launch of the Target Simplicity Challenge. I definitely think that convenience is king. That the idea of a one-stop shop for a busy working mom like myself is fantastic, and that there are a lot of things that healthcare can obviously learn from retail, making it convenient, accessible, affordable, giving consumers choices, focus on top-notch customer service, and really important, giving us a clear cost structure so we know what we're paying for as patients, and also discounts now and then as incentives to try new things is never bad. And making it sort of fun and appealing, I think, is great as well. I was mentioning earlier that at many retail pharmacies, as a person with diabetes, I consider myself a healthy person, but I live with type 1 diabetes, and I go into a drugstore and I see the diabetes supplies in an area that it looks like geriatric care. It looks like it's kind of coupled with, home disability care. It's not something that gives me any kind of good feeling about this. And I love the idea of referring to patients or consumers as guests, but I would like to remind you that when you have a chronic illness, it's kind of like being a guest in the Hotel California. You can check out anytime you like, but you can never leave. Yes. So,
well, let's extend on that for a second. Could you create a diabetes salon in the Target that would be more of an inviting kind of like, hey, here are the lifestyle choices we have for people who are diabetics, as opposed to, here are your supplies.
Yeah, seriously, that would be fantastic. And I was saying there are, for example, I mean, we have to carry a lot of stuff with us. If you ever know anyone who lives on insulin, there's a huge, they talk about the man purse for guys, how difficult it is. You need to carry sugar and you need to carry a number of supplies with you. And the cases that there are a lot of companies out there in the diabetes community who are creating these really fun, kind of consumerish cases that actually, being created by patients, they actually know what kind of pockets we need and all that. But you cannot get those in a retail store. You have to order them online from special providers. Why can't some of that more fun stuff be available at sort of point of sale where I buy my kids' soccer equipment?
Kevin?
Right. Yeah, so I agree with Amy. She was sharing with me the cute little carrying case backstage here. We can't change the fact that a disease exists or not, but what we can do is we can look at how do we, again, curate that selection of products to make what could be a very onerous chore and make you feel like you're, dealing with a geriatric population when you don't view yourself as geriatric. How can we create a better experience for something like that that's engaging and inspiring and bring what is, I think most people consider a fun experience in some retail environments into shopping for that. We're never going to make people say, hey, wow, I'm really glad to shop for this stuff. But if we can remove some of that...
Why not?
Well, maybe we can. That's great.
Do you have access on the organizational chart to do that? Are you in charge of purchasing? I mean, do you have influence into the cycle of design of the store, all that stuff?
Yeah, absolutely. And we have people that are focused, as I mentioned earlier, internally that can help with design. We also do partnerships. And as I was sharing with Amy backstage, we have somebody that's responsible for our diabetes supply category that I'm going to certainly introduce the concept to and see how it is.
I would say it's mixed messages. As a diabetic, you're told, you should eat light and exercise, be active, and then you walk into the store and the stuff, the way that it's presented there, looks like anything but that. It looks like you're going to be completely immobile. And,
right.
It looks clinical. It looks, again, for a particular very ill population, which thank God, many of us are not in that situation. So.
Yeah, the wheelchairs could go nearer to the bikes, too, Just a thought. Tim.
So I think it makes a ton of sense if you think about the shift from, acute to chronic disease, or even better, preventing chronic disease, that we should be attempting to capture people where they are and where they want to go, rather than in institutions. You only had to watch the movie yesterday to realize that most people really don't want to go to hospitals unless they're really forced to. And so we just don't capture enough of their attention when it comes to dealing with these kinds of kind of lifestyle, lifelong diseases, if you will. And so retail seems like a very logical place to capture their attention. And a store like Target, where people generally like to go and go quite often, seems like a great place to capture their attention. I do think that there are perhaps some challenges once you get people into the store, in that that a lot of what we need to translate to folks today is not just product, but it's information, it's knowledge, it's support and advice and help. My sense is that retail in recent times has moved away from that, from the kind of human experience in retail, and toward a more and more of a transactional experience. And that while you do a fantastic job of presenting the right 6 or 10 products at the end of an aisle end or a gondola or whatever, there's only so much you can do with print graphics or other forms of information to get complex ideas across. And so I think we're going to have to figure out, how do we layer those kinds of advisory, supportive relationships into retail environments where we've kind of stripped that away a lot over the last few decades. Maybe we do it through people, or maybe we do it through technology, and perhaps we can use the fact that we're all carrying digital devices around to create a layered experience in stores. Haven't seen too much of that so far. So far, we've seen mostly retailers kind of fighting Amazon and the digital retailers. But maybe there's an opportunity to bring these two things together. Maybe when I walk into store, there's a wonderful Target app that I can use while I'm in the store to get information and help to help me make choices about the right kind of products for me based on the kind of the diseases I have. But I think whatever the solution is, I think there's going to be a need to layer on top of just the product selection a lot more help and support and information for people.
So just to explore that, and thinking about yesterday, if a device that took some of your medical data and interacted within the Target store,
right,
and then was a part of your product selection criteria, that would be something that would either be too complicated, would be scary, would work.
I mean, if it's well designed, it could work. If it's not well designed, it would be scary, complicated, and put people off. But you know, whether it's about helping people make the right choices of food for the dietary challenges they have, whether it's about helping people make the right product choices, or even when they get to pharmacy, where they're purchasing drugs. I just have a feeling that there's help we could give guests, customers, that are beyond just getting the right product in their hands when they want it or when they.
Have you gone down that road, Kevin?
Yeah, absolutely. I think in retail, there's an awareness of what you're talking about, right? That we now are shifting to maybe a little bit more of a showroom also, and we're needing to create more multi-channel touch points because we also need to be where the guests are. And when they're ready to make a choice or a decision on purchasing a product or a service, we need to be available to them. So a lot of effort in that space to figure out how is it that we continue to extend. You know, in our stores, when we think about pharmacy and clinics, we already have very trusted professionals there that I think we have a big opportunity to shift more towards a service-based model, whereas historically pharmacy, you know, 3/4 of prescriptions go to community pharmacies. And a lot of those community pharmacies have simply been dispensing factories. And that opportunity for us to leverage what Gallup has cited as one of the most trusted healthcare professionals 8 years in a row in a pharmacist to identify needs or, you know, barriers to care and so on, and then connect people to the right resources is a huge opportunity for us.
All right, let's poll the audience. Pick up your devices here. I'm just maybe a little more primitive on some of this stuff. But I'm trying to think of retail interventions in healthcare, and I want to figure out if you're open to it. Let's confine ourselves to the domain of weight gain, weight loss. All right, probably a lot of people think about that. That's certainly a component of health. There's been a talk about obesity here, that sort of thing. At Target, there's sort of the food pharmacy side of Target, right? And there's the clothing side of Target, and there's many other sides as well. How many of you would be open to a Target team member? Team member, when you're buying an article of clothing, and it's fairly clear that you would yearn to fit into the size 6, but really are only able to fit into the size 10, how many of you would be open to that team member saying to you, we have a product that can help you get into the size 6? Yes or no? If you would be open to that, press yes, 1. If you would not be open to that, press 2. And let's see if your great team can come up with the solutions there. So, all right, so 1, if you're open to having someone say, here's how I could help you lose weight at another part of Target, press 1. If you're not open to that, if that would put you off, press 2. Well, we wait for the, do you think that's all right, no, okay. All right.
And I want to clarify that's not something we're proposing and ask John.
Oh, that's not no, but all right, but let's look at it the other way. Let's look at it the other way. What if you're in the food aisle and you're selecting products that seem to suggest to the team member that you're either trying to lose weight or possibly making healthy choices. I don't know, there's some sort of pattern. I mean, these retailers, they take data all the time, right? They come up to you and approach you for one reason or another and say, we have some more options for you that could help you lose weight or reach a target, or just even ask you questions about, do you have a target weight that you'd like us to help you reach? How many people would be open in the food aisle to that sort of an intervention? Yes, for 1, 2 for no. So that's no all the way around. All right, so there's an issue here of how active the team member can be in terms of affirmatively suggesting as opposed to adjacency, as you talked about there. What's the importance of the distinction between sort of active questioning versus adjacency? Because a lot of retail folks in the fashion aisle do spend a lot of time talking to you about other stuff. They just don't go here.
So I didn't know you were going to go there. Interesting questions. And I think back to when I was a primary care physician full-time, that I could have done that poll, and people wouldn't want me asking them as well. So I think just acknowledging that something like weight, that is a complex topic that requires behavior change, is not going to be a one-size approach in any way, shape, or form. Some people may want personal interaction and someone to call that out for them, but a lot of others, it may be more about how is it that we introduce people to create awareness of opportunities. Now, we don't have a specific weight loss program. We know that there are others that do that, but if we had it, then our approach would be to understand from our guests, how is it that they would be open to being introduced to that and creating awareness around it. And some of that might be in-store messaging. It might be putting information in circulars or email pushes. You know, so there'd be a variety of ways that we'd need to explore, but that's all conjecture right now.
But it is probably one of these places where you do want to put choice in the hands of the customer rather than into your hands, and to find ways of having a relationship such that they can make their choices clearer to you, so that you can help them. And we can do that today with technology in a way that we couldn't do it before without having deeply trusted personal relationships, which are probably impractical in most retail environments.
Although Google's taking data on your searches and ads and questions come up, and Amazon, there's all sorts of customized questions about, you know, what it is your preferences might be, the Genius.
But I wonder if it would be the same if instead of putting an ad up on your screen, if instead Google called you up and said, we see that you've been searching this stuff, and how about you went and did this or went and bought that product? We might not like that quite as much.
If Google called me up, I would be terrified. But if I'm already in Target, it seems like there's a gray area.
Well, I'd be interested in both Tim and Amy's approach from your perspective, and how would you solve for that? How would you
I think it's all about customization. So if something popped up that said, okay, so let's say I'm refilling a prescription for insulin or metformin, so clearly they know that there's a diabetes issue. If something pops up that says, are you interested in, you know, related food products, and I get to opt out, because I wouldn't want suddenly sugar-free everything coming up in my phone and being pestered by all these diabetic-friendly foods. That does not interest me at all. But on the other hand, there are a number of supplies that I have to buy over the counter that I need for my diabetes, alcohol wipes, adhesive remover wipes, adhesive prep wipes, glucose products that are expensive, and I need them, and they're not prescription. So if I had an option, would you like discounts or offers for, you know, over-the-counter diabetes supplies, I would opt into that, because that does interest me. But I don't want to be spammed.
or in my case, you know, if I've you know, I wear one of these, you know, quantified self things. If I've decided, okay, I want to lose so much weight, and I've got an application that says it knows how much weight I want to use, right? It tells me every week when I've got up instead of down. But if it's, you know, I could imagine how that might be. I might choose to tie that into something that Target has, so that when I walk into the store, it might point me towards particular foods or things where it's easier to control calories, or, you know, fresh foods versus you know, versus packaged foods, or it might just put up a few menu suggestions that otherwise I might not have thought of. So again, it's something that I've chosen to do. I've decided I want to lose some weight. I'm already collecting data about myself, and so I then might be interested in things that would help me. But to Amy's point, it's all driven by me and driven by the choices that I want to make. What you're doing then is, or what Target or anybody else might do, is facilitating the choices that I've made.
But it's sustained by trust. Ultimately, if you decide to opt in and share this information, the important design question for you is how do you maintain a situation of trust whereby, as we've discussed here at Transform, how can we relax some of these privacy barriers that will allow us to have more of a community sense of we're all in this sort of health thing together? How do you do that? For instance, if someone opts into getting a vaccine at Target, is that an opportunity for you to enter into a relationship on other medical data with them?
Yeah, it's an interesting question. I'm glad you asked that. You know, when somebody gets a vaccine at Target, really what we're interested in is sharing with them information, as Amy said, that they want to hear more about. And so if there's somebody that has chosen into getting an influenza vaccination at our location one year, we may send something to them the next year just as a reminder. And if they don't want to receive it, that's fine. You know, so we really try and respect that relationship, much like you would want at your clinic or hospital in that setting. And we certainly are not in a position, I know people are always wondering, is like, what are we doing with health data at Target? We're not using health data necessarily to drive sales and rest of store. So we can see patterns, you know, big data. We can see patterns of people that use a pharmacy and what are their shopping patterns rest of store based on, you know, the individual, not the individual guest, but like that group of guests. And that helps us understand that who's in our store, what offerings do we need to put in place so that it feels more like a personalization, yet it's not that I know that Tim is going to be in store and this is exactly what Tim wants. Tim can feel like we understand that there's Tim and several other people that are in a similar segment and make sure that we're prepared and have the right offerings that Tim or Amy would be looking for.
But I think that's a smart idea, the connection with a Fitbit or the new Misfit Shine. One of the options would be, okay, I frequently shop at Target, Walmart, wherever, and then I opt in to have these choices of certain offers pop up, again, selected by me when I go to those stores. That would be a great way to handle it. And I think you would have to let people periodically update their choices, and maybe there's even a little kiosk in the store, because if you walk in the store and stuff starts to pop up and you get annoyed, you can walk right over and say, you know what, I'd like to change my settings. Because I think you could alienate people with too much, you know.
Beyond pharmacy, have you thought about any other sort of quasi-urgent care offerings within Target to sort of enlarge the front end of Target in terms of healthcare? If you can do vaccines and pharmacy, what else can you do?
We currently have 66 clinics. So we're in the retail clinic space, which is primarily acute episodic care. These are things that we find, you know, busy mom or dad feels fairly confident that this is something that's a minor illness, and we have nurse practitioners that can address that. If there's a need for a prescription, over-the-counter products, that can be met at Target as well. And by the way, you can pick up a book because you might be home from work that day with a sick child, for example. Vaccinations are a big part of the clinic role as well. But I would go back to this conversation about moving healthcare away from hospitals and clinics to where people are. And there are so many other things that we could potentially help people with, where it's inconvenient right now to drive to a location that, you know, we as a healthcare system have chosen. Maybe pay for parking, sit in a waiting room, and sometimes leaving saying, I'm not sure how much I got out of that visit. And I've been on the other end of that, so I feel confident speaking that way. But if we could create an environment where a nurse practitioner in a retail location could help manage someone's high blood pressure, cholesterol, their diabetes, asthma, I mean, you name it, what role could we play in helping to assure that when people are prescribed a medication, that they understand the role of that medicine, they can remain adherent to it, and we can help them with barriers, whether they're financial, understanding their disease, et cetera. But the key to that is going to be us having partnerships. You know, we're not in a position to say that we want to replace physicians. We really want to partner and augment them. So if we can help take care of that and free up physician time back in the clinic, I think that there's an opportunity for us to distribute that work evenly and let people work at a top of licensed practice.
There's also a pass-through issue where the data might not have, it might be scary to value the data for marketing purposes. That might just sort of ruin your credibility. But as we heard from patients like me, it does have value in terms of research and in assessing the health of the community. So hospitals might be very interested in some of the front-end data that you're getting on people's choices, and that as you get people who are showing signs of various kinds of symptoms, referrals would be something that you could do at Target. Is that a space that you're interested in, or?
No, we're very open right now to discussions, and so we don't pretend to have this figured out necessarily, but we know we have an asset in our locations, the experience, the fact that we do have healthcare offerings in store right now, and are very open to discussions about people that see those opportunities and how it is that we can bring those to bear and add value.
Tim, as a design proposition, do you think a retailer that's going down this road would need to separately brand all the healthcare events that would take place in Target in some sort of pharmacy, healthcare kind of corner of the store, or would it be generalized?
Actually, one thing that I think Target has done a great job with generally is high quality communication, simple. I mean, I love that. Is it Up brand?
Up and Up.
Yeah, Up and Up. Sorry, Up is the movie. Up and Up is the brand. The way that you've kind of just simplified choice for people. So I think actually Target does a good job of that already. I think with regard to sort of what is considered to be sort of healthcare information, there may be some need to sort of separate that in a kind of brand-like way, so that people can feel like it isn't just the same as me coming and buying some Doritos or whatever, that it gets treated differently and that there's a level of importance to it. But I think you've done that around other products before. I don't see why you couldn't do it here. One of the things that I'm interested in is that as our behaviors change, kind of demographically, where there might be opportunities for Target to do an even better job than today. For instance, as more and more of us move into cities and we're living less and less of a suburban lifestyle, then what you're doing with city Targets and putting facilities into downtown. I mean, we've just opened one. You just opened one a few blocks away from me in the middle of San Francisco. It is the only decent, kind of general store that's within any easy access for me and the other few 100,000 people that live in downtown San Francisco. So there's an opportunity, and actually you're much closer than any of the hospitals. And so the opportunity to provide services in cities, perhaps with smaller footprint stores, could create even more value than you might do in the kind of current stores that are out on the edges of town.
Well, there's a huge footprint store in Brooklyn that's right near my neighborhood that is a public forum almost. It's right across from the Barclays Center. Right. It's in a really transformative urban space that Target, I think, has really taken advantage of, and I'm really kind of surprised. And it seems like there's lots and lots of possibilities. Let me ask you a question, Amy, that relates to my experience, and I wonder if we have the same kind of experience. Whenever I see access when I'm out in the world, wheelchair access, accessibility, when there's some sort of architectural feature that allows me access, even though I know it's because of some law or some regulation or some sort of stipulation, I always feel as though it's actually really about somebody cares about me. Someone very specifically cares about me. When you see affirmative sort of accommodation for the kinds of needs that you have personally, does it hit you in a sort of technical way? It's like, oh, thank you, or is it more of a hits you in the gut where you feel like you're actually being cared for when you find things like that unexpectedly?
Probably a little bit of both. I mean, it's the other thing that came with my diabetes is gluten intolerance. So had a horrible experience with the hives and gastrointestinal problems. Finally discovered that that was related to the autoimmune illness that I have. So now all of a sudden gluten-free is really trendy and it's everywhere. And even though I know it's a big trend and I think that a lot of people are just doing it because it's a trend, it's actually sort of both. I mean, technically I think, oh, that's so great for all of the people out there who suffer from this. And then somewhere in my gut, I think, oh, this is a place for me. I finally will be able to choose something other than the, chicken Caesar salad with hold the croutons, please. So, both. And I think in terms of diabetes, when you go to conferences or you're even at a restaurant where they list the carb counts, I mean, that's one thing we all just wish that we had sort of a calculator for carb counts, and some stores do offer an app where you can actually scan So packaged foods are easier, obviously, because they have carb counts, but things like that, accommodations, absolutely. I think that you have to realize how widespread these illnesses are, or these conditions.
Well, that's the point, is, you know, we're getting to a point where almost all of us have got something that we're concerned about, and whether it's exercise or weight, or, you know, and obviously less extreme than the things that you guys have been experiencing for a long time. But we're all getting to that point where we have particular needs, and if the environment around us, the stores we visit, accommodate those needs, then logic would tell me that we're more likely to be loyal to those places, feel better about them.
I have to get my little comment in about the Target branding. I love the idea of Up and Up. It's so like positive, but Up and Up is not a really great name for a glucose meter. So it's kind of a running joke in my community, really Up and Up. I mean, that's really not where you want to go, right? You're trying to keep your glucose down. So it's, you know, so you need to think these things
That's
through.
what happens when you try and brand everything with the same brand.
Everything with the same name.
Eventually you run into some problems. Down and down.
Down and down does not work, yes. Yeah. Well, final thoughts, Kevin.
Well, you know, I think there's a great opportunity. I appreciate your perspectives. I think there's a great opportunity for us to continue the conversation about, you know, not only retail, but community at large, where people's paths already are. How is it that we put resources, services, product, whatever it might be, in a way to help influence or nudge people's behavior in a way that it helps them achieve their goals. So I'm really encouraged by the conversation we've had the last couple of days.
Well, it's great that you offered yourself up here. I think it's really important to have these kinds of conversations. You know, forgive me for taking you into an area that your team's now going to deliver 1 million memos to you about, but I really think your candor is important, and the idea that these things are possible, I think, is really what this conference is all about. And, you know, it pushes us to not only radical thinking, but tangible thinking as well. And Tim and Amy, thanks so much to you. Tim?
I would say, I'd also like to congratulate you for the contest, in the sense that I'm a big believer, and I think Andrew was just talking about it in the last session, that complex systems don't get solved by a few people kind of getting in a room trying to figure it out, that they get solved by lots and lots of kind of interesting and incremental solutions that can come from a lot of different unexpected places. I'm a big believer in kind of crowd-based design. We found it to be very successful with the efforts that we've pursued, and we've seen it with the challenge we've just been running with Mayo for this conference. So I'm excited about what the challenge might result in terms of interesting, new, simple ideas. And I just congratulate you for putting it out there and inviting people to participate.
Thank you.
Tim, Amy, Kevin, thank you so much. Really appreciate it.
Thank you.
Thanks. That's great.